The fourth winner is from the government sector and from Western Australia, and it's called the Multi-Systemic Therapy Program from the Department of Health in WA. Congratulations. This program began in September 2005 and is funded by the Western Australian Government. The program targets families with a young person who has a history of severe antisocial behavioural problems. The program educates and trains parents and caregivers to provide them with the skills to manage the young person's behaviour themselves and to assist the young person to improve their behaviour. The program demonstrates an enduring reduction of antisocial and illegal behaviours in the vast majority of young persons helped. Increased involvement in more pro-social activities with pro-social peer groups also helps the young people avoid involvement in adult antisocial and criminal behaviours. And I'd like to ask the Multi-Systemic Therapy Program Manager, Mr. Mark Porter, to accept the award today.
It's a long way to come across from Western Australia, but to listen to some of the projects here this morning, it's well worthwhile already. So, what I'd like to say, first of all, is just thanking the Institute of Criminology very much for the recognition of our program. Our program is a small program really within mental health services, and it's quite unique within Australia in that it's the only program really targeting really high-risk youth that we know are sort of destined for a life of criminal behaviour if we don't intervene. So having the support and recognition from awards makes a crucial difference. Our clinicians teach parents improved communication with the young person, the school, other parents, and the parents learn to better monitor their children and more effective methods of influencing their behaviour. But basically, it's a short-term intervention of only 3 to 5 months. The clinicians are mainly psychologists or social workers. We train parents, we help them in the unique environment that they're often dealing with. And I guess what makes it really different from most mental health settings is that it's in the home. And it really makes all the difference. And what we've found by following these cases for up to 18 months after they've been through the intervention is that the gains that the parents have made are sustained in about 80% of the cases, which is really quite effective, especially if you consider that 20 to 30% of the cases that we've seen have been Aboriginal families. And we've had equally the same sort of success across the board with those families. What I'd like to do is really thank many people who have been involved, especially in the initial setting up of this program, the executive of the South Metro Mental Health, the Child and Adolescent Health Executive in Western Australia, some of the clinicians that we've had working for us. It's unique within the public service if you think that these people are on 24/7 call to families every day of the year through the intervention. Incredibly dedicated and loyal staff who I'd like to acknowledge at this point. I'd also like to acknowledge our research officer who is about to retire and become a mother, but for the last 5 years she's been really rigorous in following up these families and really being able to supply us with some rigorous research, which I think has helped our program enormously. Finally, I'd like to acknowledge really the parents who we've worked with. These are parents who were often at the point of giving up on their children when they've come to our program, and yet their love and courage has seen them sort of stay in there and save their children really from themselves. It's been incredibly uplifting to work with people like this over the last 6 years. So thank you.